Good evening, everyone, and welcome to another hour of Healthy Conclusions, where we try to give our listeners important information on nutrition, exercise, and holistic, alternative, and integrative medicine. Please take a minute to visit our website at www.healthyconclusions.com and like us on Facebook. My name is Bob Neugebauer, and I will be your host for this evening's show. Tonight's show is being brought to you by Altrua Health Share, which has been serving its members and their families with their health care needs since 1997. Please take a moment to visit their website at altruahealthshare.org or call 888-244-3839 to see just what Altrua Health Share can offer for your family's health care needs. It might mean substantial savings to you. Our guest for this evening is Sharon Hammer. Sharon is come back for a second appearance on our show, and she is so accomplished in so many areas. We felt it important that we bring her back to talk about something very critical in today's times. Sharon has received the Master's of Mental Health Counseling at Idaho State University and will soon be registered as a licensed professional counselor, and this is the part of her background that we're going to use today. In addition, today, she is a registered yoga instructor and holds a BA in Business Administration and a law degree from Southern Illinois University, along with a master's in Public Administration. She's also a trained structural and wildland firefighter and EMT. Tonight we're going to talk about trauma, something that most of us will encounter at some point in our lives. So good evening, Sharon, and welcome to Healthy Conclusions, and it's nice to have you back again.
Thank you, Bob, for having me back.
I'd like to start off tonight by having you explain or define what trauma is to you.
So, Bob, before we get started even with a definition of trauma, one thing I'd like to mention is that as we talk about trauma and traumatic experiences, and with your listeners as they listen, they may have experiences of recalling or even feeling their own traumatic experiences in their lives, and that's a very typical response. And if that is the case, I'd just like to let people know that you don't have to suffer alone, and that there are resources and help out there if you've had a traumatic experience in your life. I just think that's an important thing to recognize. But there's a typical sort of a definition for trauma is an experience or a situation in someone's life that is emotionally painful and distressing. And then the really crucial part of that is that it is an overwhelming experience for a person, and they don't necessarily have the coping skills for the situation.
So there are different types of trauma. How would you classify them?
Two sort of large, under the umbrella of trauma, there's two sort of bigger categories. The interpersonal trauma, and that is when the traumatized person knows the perpetrator, and that the injury is caused more deliberately. It may be intentional and malicious. That is the most common type of trauma in our society and can be the most devastating and have the most lasting effects. And then there's the impersonal trauma, which is more like an accident or perhaps war, may be more impersonal. So those are two of the bigger categories. But then when we look at the different types of trauma, it can almost be as many as you can imagine. I mean, it can range from child abuse, natural disasters, motor vehicle accidents, rape, sexual assault, sex trafficking, torture, war. One of the more newer types of traumatic experiences is mass interpersonal violence, like 9/11 or things like happened on the Tower Bridge in London.
In terms of definition, which would you consider the worst trauma that someone could experience? And is that something that would depend on the individual or their particular mental state?
Yeah, so when you say like the worst trauma, it really depends on the person. because trauma is relative to the person. It not only depends on the person's mental state, but other variables that influence how the person will be impacted, like gender. Females are more vulnerable to trauma. Age, the very young and the very old. Race, being in a minority, makes you more vulnerable to trauma. Your own sensitivity, support systems that you have in place, family dynamics, access to resources. One interesting thing that we might want to just touch on is the prevalence of trauma particularly in our culture in the United States. There has been many studies on trauma and the effects of trauma, and there are studies that indicate that more than 50% of adults in the United States experience a physical trauma at some point in their life. And if you add on then psychological trauma, you can imagine that number would get much higher.
I would imagine that everybody at some time in their life would experience some sort of trauma.
I would imagine that also. It's hard to imagine that someone gets through life, without being touched to some degree by trauma. But when we look at like child abuse in the United States, 25 to 35% of women and 10 to 20% of men describe being sexually abused as a child. Up to 30% of people are involved in natural disasters like earthquakes or large fires, floods, avalanches. Motor vehicle accidents, 20% of the people in the United States are involved in major motor vehicle accidents. Rape and sexual assault, 15 to 20% of women in the United States experience some sort of sexual violation. And intimate partner violence is as high as 25%. And that's all studies within this country.
Well, these are all kind of extraneous, but I'm talking about just day-to-day life. In general, there are 5 different types of trauma that we as individuals experience during our lives. They are death of a loved one, divorce, moving, major illnesses, and losing a job. We all deal with these circumstances in different ways mentally, but in your opinion, should a person get counseling for any of these circumstances? Or are they just something that happens normally? And you wonder whether they pile up or build up over time.
Well, and Bob, you did mention 5 types of trauma that many people experience in their lives. And those are 5 types, but, as we mentioned, that trauma can be relative to the person. Really, any experience that a person has in their lives that they find overwhelming can be a traumatic experience. Childbirth can be a traumatic experience for a woman. And so it depends, like I mentioned, like on the sort of the nature of the person. And you said, part of your question was, should a person get counseling? So in the counseling world, the word should, not to parse words, but, the word should can often imply shame and be directive. And that's part of what we avoid in the counseling world, is to add shame and be directive. But what is more important is that regardless of a situation that a person is experiencing in their life, that connecting with a counselor, somebody that is objective and that regards that person with unconditional positive regard, can help an individual process any type of life challenges that they may be experiencing.
How does trauma affect our bodies? Because if our mental state is stressful, it would only be right to assume that our bodies would be under the same stress conditions or stressful conditions, which could cause any number of problems.
You are exactly right when you say cause any number of problems. When someone experiences a traumatic event in their life, it is a body, mind, and spirit, soul are all linked in it when you have a traumatic experience. There's the research by Bessel van der Kolk, who is a psychiatrist, has done quite a lot of work on how the body holds on to trauma and the physiological responses of the body to trauma. And what his work has shown is that after a traumatic experience, a person's nervous system can be reset to be more easily triggered. And the work of Rachel Yehuda, she's a neuroscientist that is done quite a lot of work in the new field of epigenetics, and it is the study of how trauma and resilience can cross generations and how it can actually be passed down, and how the body is affected at a cellular level. But when we look at things that might be more obvious that we can actually see and how we may experience trauma in the body, it could be kind of surprising. It can have effects like experiencing fibromyalgia, chronic fatigue. It can affect autoimmune system in the body. It can affect digestion, posture, sleep cycles, thought processes.
Well, it's an awful lot of things that can be affected here. We're going to have to take a quick break, but we'll be back in a few minutes. You're listening to Healthy Conclusions, brought to you by Altrua Health Share, with your host Bob Neugebauer on 580 KIDO AM and 107.5 FM. Welcome back to Health Conclusions on 580 KIDO AM and 107.5 FM. We're speaking with Sharon Hammer, sponsored by AltruaHealthShare.org. Okay, we're talking about trauma, and we were talking about how it has the effects on our bodies. Now, we all know many of our military personnel have experienced PTSD, and in fact, it has become one of the largest problems of those returning from armed conflict. Can you explain what PTSD is, and is it treatable, and how does it affect these people?
So PTSD, post-traumatic stress disorder, is a specific diagnosable mental health condition that is defined in our as mental health counselors diagnostic manual, the DSM, Diagnostic Statistical Manual. It is in its 5th edition, and there is specific criteria to diagnose an individual with PTSD. And it became a diagnosis during the Vietnam War era when soldiers were returning from war. And there has been a significant amount of research of the condition and with veterans. But I would venture to say that the response to war has probably always been there. Now it's called PTSD. I think before it may have been called shell shock. But as you can imagine, what a person might experience in war could easily overcome a person's ability to cope. But the definition of PTSD is also controversial. In this edition of the DSM, the definition requires exposure to actual or threatened death or serious injury or sexual violence. And not everyone agrees that there has to be exposure to actual or threatened death. So many people who work in the field don't agree with the definition for a diagnosis. 2 individuals, John Breer and Catherine Scott, define PTSD as an event that is extremely upsetting, at least temporarily overwhelms a person's internal resources, and produces lasting psychological symptoms. I tend to agree more with that definition. But it is developed by experiencing a traumatic event, either experiencing it yourself or also witnessing it. And then symptoms that can develop from that may include flashbacks, nightmares, severe anxiety, uncontrollable, intrusive thoughts. And part of your question is it treatable? There are many different treatment modalities that have been researched and that are developing, some more successful than others. A lot of times it will depend on the nature of the person and their ability to process their experience. And that will, again, depend on some of the things that we mentioned: gender, age, race, their own sensitivity, family dynamics, access to resources. But part of what is important is to understand that, we are shaped by our life experiences. And though our life experiences will always be with us, we can't change the past. But can we get to a place where we can perhaps make meaning out of what happened, or at least be able to relieve some of the symptoms. When you say treatable, if the goal is to stop flashbacks, nightmares, reduce the anxiety, reduce the impact that it has on someone's ability to enjoy life, then yes, there are many different types of treatment that are available to people. Part of the problem is that trauma is isolating. There's a lot of shame associated with trauma and guilt, and that people are resistant maybe to seeking help. In our society, it's often, you'll hear, just get over it, move on, let go of the past. But if you don't personally have those skills, being able to reach out and connect with someone that can help you can be really important.
There are those that say that there's no cure for PTSD and that it can only be managed to restore an individual to a normal functioning state. Do you believe that these people can be cured at some point in time? And if so, by what means?
So I want to unpack a little bit what you said when you refer to sort of normal functioning state. Because if you mean by then being able to relieve the nightmares and flashbacks and the intrusive thoughts, there are treatments that can definitely help reduce, eliminate, process, and move past those symptoms. And I want to be careful with the word cured, because it depends on how we define the word cured. If it is that they don't remember what happened, I don't think that most people want to forget the experiences that they've had in their life. But I do think that many people want to try to make sense out of experiences that they've had in their life, or find some meaning and also perhaps growth from the experiences that they've had. So I think an important question is, can the person make meaning out of the experience? Can they grow from the experience? Can they then become more resilient? Because in my experience, and I had a traumatic event in my life, so I'll speak from my own personal experience, that the adversity and distress that I went through has helped me grow. It definitely changed the course of my life. It was a very difficult time in my life, but through the help that I have received along the way, it has helped me become a more resilient person and a different person.
So you found that you could eventually make use of the situation that you were involved in. Do you think that a lot of people who are coming back from these crazy wars that we're having have the ability to do the same thing and actually cure themselves over time and just relate back to those past histories and that are in their mind and kind of take them with a grain of salt, or a learning process?
Well, I want to be careful that I don't sound dismissive and unempathetic about a traumatic experience that people have, because that's not my point. And depending on the intensity of the traumatic event, it can be devastating in a person's life. So I want to respect and honor that. When you said, can a person recover themselves, I think that seeking help, and that may be an integrated approach to help. It may include the medical profession, it may include the mental health profession, maybe some other holistic approaches that can help that person process their experience. The problem with trauma is that people tend to get stuck back in the past. They have a hard time being in the present, and they see no future. So part of what we do as a counselor is that help them process what happened in the past, live in the present and enjoy life, and also see a future for themselves.
Most drugs used to treat PSD are quite powerful. If you take a look at the list, Are there other ways to treat this problem without risking the use of these drugs, these powerful drugs that they're using?
Depending on the situation, drugs may be an important viable option at the time. For example, like if an accident can be a traumatic experience, and if you are injured and you're bleeding, you need to stop the bleeding, you need medical attention, and drugs may be necessary. But as we look past that more immediate, short-term intervention, do I think drugs are overprescribed? I do. I think that if they serve a purpose in the short term, that's great. But then in the long term, I don't think most people want to be medicated. The drugs have a tendency to be numbing, and I don't think that that's what most people want to experience.
Well, I would tend to agree with you that most people don't want to be on drugs, but again, we find that the prescriptions that they're putting out for these people, and even children that they're diagnosing with ADD, Ritalin, and all of these other drugs, are causing a bigger problem than the diseases supposedly that they have. And I found that the government pays more money when they have the kids on drugs, which doesn't make an awful lot of sense. So, there are always, ways that the drug companies find that they can push more drugs out there with incentives from different organizations. And I just kind of like to see that cut down. That's one of the reasons I asked the question. I have a lot of friends of mine who happen to be on drugs that do have past history and traumatic experiences from the war.
And the adverse impacts, the long-term adverse impacts of drugs, some we don't even know about. And that is a problem with the drugs.
Okay, we're going to have to take a quick break here. We'll be back in a few minutes. You're listening to Healthy Conclusions, brought to you by Altrua Health Share, with your host, Bob Neugebauer, on 580 KIDO AM and 107.5 FM. Welcome back to Healthy Conclusions on 580 KIDO. We're speaking with Sharon Hammer, and we're sponsored by altruahealthshare.org. So, Sharon, let's get back to here. We were talking about drugs and the fact that we don't have enough counselors probably at places like the VA to handle this. But I'm sure that, now they're actually working on trying to change some of that. But I'd like to enter another phase of this. Is it true that a person who is constantly abused as a child or sexually as an adult can experience the same symptoms similar to PTSD?
So PTSD is one response to trauma. And like we had talked about, it became a diagnosis during the Vietnam War era. But it is a person's response to a traumatic event, and that can be for someone that experiences something like child abuse, sexual abuse. And we talked earlier about sort of the two big umbrellas of trauma, the interpersonal and the impersonal. So something like child abuse and sexual abuse tends to be an interpersonal trauma and occurs more frequently than the impersonal type of trauma. It can be more devastating, and it can lead to more chronic negative outcomes, such as emotional and cognitive behavioral problems, increased risk for health problems, particularly when you have a situation where a person is abused, neglected by a primary caregiver, like a parent and a child. Because as a young child, you look to a parent as providing a world of safety and love and comfort. And when the child is in that relationship with that person, and they're also experiencing horrific experiences, sexual abuse or neglect, the child can develop a lot of conflictual feelings, attachment disorders.
What are the factors involved in trauma situations?
So when we talk about the factors involved, there is usually a power differential, like we were talking about, like a parent-child or a teacher-student, a priest that works with young children in the church. So there's quite often a power differential. I don't like to use the word victim because for me, it sort of implies a helplessness. I will more often refer to the person as the person who has experienced trauma.
You're talking about one person having more power over another person. Is that correct?
Yes.
Okay.
There can be a loss of choice in a person's life, a loss of control. Those are factors. It's often, but not always, a physical violation.
So it could have to do with the job, the loss of a job, or being stuck in a particular job?
Absolutely, yeah. Yeah, employer, employee, that's another power differential. Doctor, patient, that's a power differential. You know, we were talking earlier about, like, when someone assumes that a doctor has their best interest in heart, and hopefully that they do, but maybe they're not considering alternative types of treatment other than the medical.
Okay. Hypervigilance, exaggerated startle response. Are these all responses that are part of a trauma syndrome?
They most definitely can be. With the work of Bessel van der Kolk, he has studied the body's physiological response to trauma. And just a little bit about explanation about how the body's physiological response to trauma is that. So the autonomic nervous system in the body is the system in the body that supplies and regulates our internal organs, and it has two sort of divisions: the sympathetic nervous system and the parasympathetic. And so after the autonomic nervous system receives information, it responds by either stimulating the body's processes through the sympathetic nervous system or inhibiting them through the parasympathetic nervous system. And let me just give you an example. So if you are threatened or you're experiencing a traumatic event, the sympathetic nervous system is going to be activated, and the body will push blood into the extremities to make you literally faster and stronger to be able to save your life.
So that's fight or flight?
That's freeze, fight, or flight.
Okay.
The other half of that, the parasympathetic nervous system, is the body's rest and digest mode. That is the body's opportunity to heal, to be able to process out the stress hormones, the cortisol, norepinephrine, adrenaline, out of the body. It actually draws the blood into the abdominal area and the digestive tract so you can digest your food, you can assimilate the nutrients. In a non-traumatized person, these systems work in harmony and they're balanced. So a person would normally spend about as much time in the sympathetic as they are in the parasympathetic. But a traumatic experience produces a physiological change that can be a recalibration of the brain's alarm system and an increase in stress hormone activity in the body, so that you might have like a trigger response to a traumatic experience.
Kind of like adrenaline.
Adrenaline, yeah. Or a smell. Like if you are in a situation like a car accident, and perhaps you are pinned in a car accident where there is the smell of burning rubber, and, you know, it could be years later, where you smell that burning rubber, it could trigger that response back to the body producing the stress hormones.
So we don't realize it sometimes, but when you experience a traumatic problem, your body actually changes physiologically, and it's producing hormones that it would not normally create.
Absolutely. You're absolutely right. It perceives threats differently, and the nervous system can become hypervigilant. And that can go on for years after a traumatic event. And the problem with that is that's really hard on the body. Those stress hormones, while they have a purpose, and we want them because we want to be able to, when we need to, fight harder, run faster to save our lives. But particularly in our society, and when you have experienced a traumatic event, the body can continue to produce those hormones, and that's really hard on the body. And we often don't give ourselves the opportunity to allow the body to engage the parasympathetic nervous system so the body can begin to heal itself.
So these are involuntary actions that your body just automatically does.
Autonomic, yes.
Okay. Once a person has suffered trauma, how would they react the next time they are confronted with a similar situation? Would they be would it be the same type of traumatic experience, or would they react differently having been through it once before?
Well, so it kind of depends on what has happened since the initial traumatic event. Say, for example, that a person goes through a traumatic event and they just stuff the experience. They don't process it. They don't talk about it. They are ashamed. A lot of that shame and guilt that's associated with trauma. They're embarrassed by it. So in that situation, when the person has another traumatic event and they're still working at that that high vigilant level, it could be even more devastating. However, if a person has a traumatic event and they are able to process, able to make meaning out of, able to become more resilient, and they have a subsequent event, there are studies that support that the person is even more resilient. A person that's had one traumatic event, when they have a second one, it doesn't affect them quite so much. Or when they have a third one, it may not affect them as much. And let me give you a good example. Say, for example, that you are in a life-threatening situation. War is a really good example. Would you rather be in that situation with someone who has never had to figure something like that out before, or with a person that has been in that situation and survived and has learned and developed skills to be able to save themselves and you?
Well, I myself have experienced, what you would call traumatic experience. I've had guns pointed at me twice, and I've been shot at once outside of the service. And I have to tell you, the first time, I was scared to death. The second time, I wasn't quite as worried about it.
So you had that direct experience.
Right. I mean, when somebody shoots a window out of your cab, that's scary. The next time when somebody points a gun at you, it's a little less scary. And then the third time, it kind of becomes a normal reaction. All you want to do is get away.
Right. Yeah. So you actually have lived that experience.
Sure.
and had that experience. The problem in our society is that, we hear that just get over it, let it go, move on. And also, unfortunately, there is often a stigma associated with seeking counseling, that you're weak, that you can't handle it, and in the worst case scenario, that you're crazy. And very strong emotions can be scary. But we want to be able to process that.
We're going to have to take a quick break here. We'll be back in a few minutes. You're listening to Health Conclusions, brought to you by Altrua Health Share, with your host Bob Neugebauer on 580 KIDO AM and 107.5 FM. Welcome back to Health Conclusions on 580 KIDO AM and 107.5 FM. We're speaking with Sharon Hammer about trauma, and we are sponsored by AltruaHealthShare.org. So let's get back to where we were before. We're talking about, and I was telling you about some experience I've had in my past and how I reacted to them. And I kind of reacted less and less frightful each time this happened. But is it normal for a person, once they have been through a traumatic experience, to try and block that experience from their thought process?
Well, and when you say normal, I think in our society, we're almost taught to do that, not to experience it, to block it out, move on, get over it, let it go. But we don't necessarily have the skills to be able to process it. And that's where seeking help through a counselor or some sort of treatment that helps the individual process the emotions. My counseling mentor, Melanie Twite, refers to emotions as the language of the soul. And counseling is one way that we can help an individual create a safe space in the counseling room to be able to listen to that, what your emotions are telling you, to be able to begin to process those emotions. Because otherwise they can be really scary, because we're not taught that typically in our society, how to process scary emotions.
Well, can you go through some of the processes of healing those that do have traumatic experiences?
Sure, and there are many different treatment modalities that are available, and the most important thing is that the individual find someone, a counselor, and the method that they connect with, and a method that resonates with them. Part of what we do in the counseling world is just acknowledging the experience that the person has and honoring that if it was a traumatic experience to that person. There can be shame associated with being a sensitive person. Oftentimes, kids are shamed for being sensitive. And what we try to do as counselors is connect to that person, acknowledge the experience that they have. In talk therapy, allowing the person to tell their story, to create a narrative around their experience, can be really empowering. Psychoeducation, educating a person about the psychological responses, the physiological responses in the body, can be really empowering for a person. For a person to know that it is a physiological response, for not to think clearly when they're in a traumatic event because they are in the fight, flight, the survival mode. That can be really empowering. Normalizing a person's response. Rewiring how the body responds to trauma, and you can do that through emotional regulation, and that's skills that individuals can develop. One of the programs that I am most familiar with is it's called iRest Yoga Nidra, and it is a meditative and deep relaxation practice. And it was actually developed at the request of the military because of the PTSD diagnosis that we were seeing so much of, by a gentleman by the name of Richard Miller. And it took a very old yoga practice, a yoga nidra practice, and it more modernized the language. He's developed it more specifically for our Western culture. And that iRest Yoga Nidra program has evidence-based studies that support its effectiveness specifically for diagnoses such as PTSD.
You know, for years, and especially here in Idaho, we've talked about the mental health problems that we have here, even in our state, and the problems without having a facility to help a lot of these people, or the people to help them do the things that are necessary, which is one of the reasons that I keep talking about integrative medicine, because there are so many different ways to heal people that we have either forgotten, we don't use in normal medicine nowadays, because everything seems to be coming in a pill format. So if they don't have a pill for it, they don't know what to do for it. Do you think that bringing integrative medicine back into the limelight and offering opportunities for meditation, for yoga, for Tai Chi, for things like this could actually be beneficial to helping these people who have these mental illnesses? Or so-called mental illnesses. We may call them whatever we want, but I don't even like the word mental illness.
I don't either.
But everybody has experiences in their life which cause them to have problems.
Absolutely.
But don't you believe that there are different ways to handle them rather than a pill?
Yes, Bob. Absolutely, I agree with you. I think that the drugs are overprescribed. I think they're appropriate in some situations when it helps to stabilize a situation or a person. But most drugs have adverse side effects. And what you're in when you ask me, do I think it will help people use an integrative approach? Absolutely. I've seen it with my yoga students as well as my counseling clients, and I've had my own personal experience through the traumatic experience that I went through. I was prescribed drugs, and it helped me at the time because my experience was so overwhelming that I was either suicidal or homicidal. And it helped me get through that period of time. But then once I were able to become stabilized, I was able to begin to get counseling, begin to explore, why did this happen to me? What does it mean? And I think that gets to the essence of being able to, for a person to be able to process their experience, to make meaning out of the experience.
You know, I believe that stress is the great immobilizer of our world nowadays. There are so many different stressful factors that take place in our lives, whether they be at home or whether they be at work or, just personal experiences out and about. Don't you think that we need as a people to understand that everybody's got their own problems and we become critical of those around us? And we make the situation even worse by, I guess, being impersonal about it and not recognizing that certain people do have problems.
And then recognizing that people have different levels of sensitivity.
Right.
That some people may be more sensitive than others. Some people, can go through the same experience and walk away as if it were a blip. And another person, it could be the most devastating thing that's ever happened to them in their life.
Well, so I think we've talked about the fact that drugs are a problem. They do help in some cases. I prefer to stay away from drugs. It's not one of my things. Doctor offers me a drug. I say, no, thank you. I'll find a better way to do it. I don't think enough people do that. But I'd like to kind of get to a final question here. Do you think people who have a strong religious background would have an easier time dealing with trauma than some of those who don't?
I think in some situations, a person that goes through a traumatic experience could lose their faith and say, if there is a God, why would a God let this happen? I think that others can bring them closer to their spirituality. I think it depends on the person, it depends on their circumstances, it depends on the help that they get. I think many people will look for a greater meaning in their experiences, and that may lead them to spirituality or their religion.
Well, Sharon, I want to thank you for being here with us tonight. It's been a pleasure talking to you again. I hope to get to one of your yoga classes again one of these days.
You are very welcome. I hope you do.
We're going to attempt to do that, and please let us know when you get your certificate. Maybe we'll find some clients for you. Hopefully, I won't be the first one, though. This is Bob Neugebauer signing off for Health Conclusions, and we hope you will join us again at the same time next Sunday for another hour of informative talk about nutrition, exercise, alternative medicine options. This is sponsored by AlchuaHealthShare.org on 580 KIDO AM and 107.5 FM.